1,000 cases a day in 2 weeks. 2,000 in a month. Now that's the projection Finance Minister Lawrence Wong made last night if COVID-19 continues to spread in the community at the current rate.
The number of new local cases nearly doubled to more than 1,200 last week. But what concerns the authorities are not these absolute numbers. Rather, it's the virus's reproduction rate, or R, which is currently above 1.
We know from the experience of other countries that when cases rise so sharply, there will be many more ICU cases and also people succumbing to the virus. It's not just the unvaccinated seniors, because even for vaccinated persons, there will be a small proportion of them falling severely ill. And if you have a very high infection caseload, that small proportion will translate to a sizable number of ICU cases and eventually fatalities. So we have to slow down the transmission rate and bring R down. We will attempt to do so without going back to another heightened alert. And in particular, we will go for aggressive contact tracing and ring fencing of cases and clusters and push for more pervasive testing.
And so workers in most sectors, including public transport frontline staff and supermarket workers, must undergo mandatory fast and easy rostered routine testing. These will be done more frequently, from once a fortnight to once a week.
The government will also issue to all other companies 8 ART kits per employee. On-site staff members are expected to do weekly testing over a 2-month period.
As for ring fencing, when new clusters are detected, health risk warnings and health risk alerts will be issued to exposed people. There are different actionable steps for each, but individuals on either should reduce their social interactions for 14 days.
What do the experts think of the new measures? Joining us now is Professor Dale Fisher, Senior Consultant at NUH's Division of Infectious Diseases. Welcome back to the show, Professor. Are the measures announced yesterday to slow down the community spread enough, Professor, since most of it is self-directed, own self, check own self, in other words?
Yeah, thanks, Haryanto. Listen, I think we need to keep going back to what the strategy is. And the strategy as we transition into endemicity is to prevent severe illness and death, and obviously at the same time protect hospitals from being overwhelmed. It isn't to stop spread, and we need to get a bit more comfortable with the case numbers, but because we've got a vaccine that doesn't block transmission, so this is why we need to talk about endemicity rather than eradication. So in the future, not too distant future, we will be treating this like the cold or flu. We won't track every case, we won't diagnose every case, and we know that COVID, like these other viruses, will just circulate freely, but be quite mild in that sense, not like COVID was in the pre-vaccination period. So I understand why these new measures are in place, though. This, I guess, personal responsibility to try and limit transmission, and this is because as we try and transit, we want to do that gradually. We know the case numbers will go up, and we want to see what the impact of those case numbers going up is on hospitalizations and severe disease. But it's just going a bit fast. I think it's going a bit faster than any of us thought. The numbers have doubled over the last week, and that doesn't give us time to monitor. So this is why, without bringing in new rules, the authorities have just said, can everyone just try, decrease your activities, slow things down a bit, let's buy some time so that we can gauge the impact of these high numbers.
Well, Prof, given what you've just said, while restrictions are said to be necessary to bring down infections, it doesn't sound like we're treating the disease as endemic. So do you think it's time to reassess our strategy here to becoming COVID-19 resilient?
Yeah, I don't think, Olivia, that the strategy has changed. At least I hope it hasn't. The most important thing is that we don't get too distracted by case numbers, but it's okay to look at it in terms of a rate. And as I said, the rate's going too quickly. We knew the rate would go up, but think about it. There's probably 5 or 10,000 flus or colds every day in Singapore normally. Of course, there's been none during COVID because of the measures, but this is how it normally happens, and we don't count them. What we do count with flu is the types of flu and how it's evolving genetically, and the severe cases, and that's really got to be our endpoint with COVID. I am concerned that some people are going to get too concerned over the number of cases. The number of cases used to matter, but now it matters a lot less, and eventually it won't matter at all. The disease in vaccinated people is very mild, and in fact, we wouldn't have, what we've done over the last year and a half, we wouldn't have done that if COVID was like a cold or a flu. We did it because it was very severe. Now it's less severe, so now we need to adjust that balance in time.
Professor, let's talk more broadly. We have vaccines, we have safe management measures, but numbers are increasing. Of course, you mentioned that eventually these wouldn't matter as much anymore. Have we exhausted our options in this fight?
The fight is to prevent severe disease and deaths. That is most successfully done with the vaccine. So, of course, we need to be looking for vaccine waning. I'm not convinced that we're actually seeing that yet globally, at least not in a clinical sense. There's also a handful of people that are still not vaccinated, and it would be very important to still try and mop up, if you like, these last few people, whether I think there's maybe 10% of the over 12s are still unvaccinated, and to try and find those people, help them understand that the COVID vaccine is a lot better than COVID, which is somewhat inevitable if you're unvaccinated. So I think that's probably the most important thing in the armament. The other thing is, as I've alluded to earlier, is this mindset change that's really important. Every time we've gone into a new phase of this pandemic, from the first time we closed borders to put our mask on for a first time, this all required a change, an adjustment into how we were going to behave. And now it's time for us to get used to the next phase, which is getting used to the case numbers, or ideally not even count them and focus on things that matter, like numbers in hospital.
Right. Well, Prof, in Singapore, the Delta variant's reproduction rate, or R0, is slightly more than 1. This is also something Minister Lawrence Wong said yesterday. Overseas, Delta's R range is between 5 and 8. So Singapore's R value is comparatively lower. What's your take on that?
Ultimately, we need to not care so much about transmission. Stopping transmission was critical in the pre-vaccination phase. That was our only tool to stop people getting disease, getting severe disease and dying. But now, stopping asymptomatic transmission is actually much less important. It's about having people vaccinated so that when they get infection, it's very mild. In fact, actually, Olivia, it's quite reasonable to consider that if you're vaccinated and you get asymptomatic COVID on top of that, then in a way that's a booster. So that's actually enhancing your future immunity. So it's kind of a good thing. It's complicated.
Well, Professor, nonetheless, we appreciate you coming on the show to give everything some perspective. We've been speaking with Professor Dale Fisher, a senior infectious diseases consultant at NUH.